Hi viewers, welcome back. In today's video, we are going to discuss about epistaxis. Okay, so it is in common terminology, epistaxis is also called as nasal bleed. Okay, so when you have bleeding from the nose, you term it as epistaxis. Okay, so now we will discuss. So what is the etiological factors that is causing nasal bleed? Okay, the first reason in most of the condition, it is because of crusting, cracking and irritation. Sometimes because of the dust particles, there is like crust formation, and when there is crust formation, usually children and all, what they will do is, like when there is a crust, they try to remove it by their hand. So when they do it like that, what happens? There may be a crack, and because of that there may be a nasal bleed. Sometimes it is because of running nose. So when there is a running nose, because of continuous irritation, when you keep on blowing and when you keep on rubbing the nose, at that time there may be a nasal bleed. Okay, and then we have inflammation or nose picking. Some children, they have habit of nose picking, so every now and then they will be picking up their nose. So they always say there is some particle that is obstructing the nose. So at that time they keep on irritating the nasal area, and because of that sometimes it can bleed. And sometimes there is an inflammation. When there is an infection, there may be an inflammation, and because of that there may be a bleeding episode. And then overuse of nasal sprays. So nasal sprays, when you use nasal sprays for the bronchodilation, sometimes when there is a nasal block, at that time when you use nasal sprays, and this inhalers, when you use like small inhalers are available when you want to like make your respiratory passage clear, at that time all these can cause dryness of the skin and they will cause bleeding. Okay, that is the reason we always tell, like you have to restrict the use of nasal sprays which can induce bleeding. Snorting is nothing but it is the blowing up of the nose. When there is a secretion, you try to force and you want to remove the secretion. So when you keep blowing your nose very heavily, at that time also it can start bleeding. Then we have hypertension. When there is an increased blood pressure level, at that time, when there is a very high increase in the blood pressure level, at that time the patient presents with epistaxis. So at that time your first management, like immediately you have to check the blood pressure of the patient. And then we have blood disorders. When there is blood disorders, that is like coagulation disorders, when there is an leukemia, when there is an disseminated intravascular coagulopathy, all these conditions, what happens, there may be a bleeding episode. So you have to identify what is the cause for this bleeding episode, you have to rule out. Okay, so that is with etiological factors. This epistaxis is very common with boys, and usually boys around the age of puberty. So what happens is their physical maturity, so they will be having this voice modulation and all those things which will which when there is an increase in their hormonal levels, it can cause dryness and it can cause bleeding. So it is very common with puberty boys. Okay, so those children, it is very common, and most of the time, that is like around to 90 to 95% nasal bleed is because of any of these minor disorders, and it is not going to have a major effect on the body, and it doesn't need a medical attention even. So what we have to do is, like, you have to worry about the remaining 6 to 10%, like where you are worried about the medical condition, where we are worried about like the costs for medical attention. So that is like you have to rule out when there is an increased blood pressure, when there is some inflammation, when there is a tumor, all these things you have to rule out. So in that condition you will be able to identify whether the child or the adult needs an medical attention or not. So that is with your incident level, and then management. So management, here your pathophysiology and your signs and symptoms, you don't have your greater pathophysiology. So your signs and symptom is like only your nasal bleed. The child or the adult, why I say child again and again is most of the time it is very common with the children. When they present, they present with nasal bleed. When they come, just they hold their nose and come like where they are bleeding heavily. Okay. So, the management part, when they come, you have to position the patient. So, what is the position? You have to make the patient sit straight and you have to tell the patient to bend. Okay. So, this bending, what will happen is like it will help in, like, due to gravity the bleeding comes down. So, when the bleeding is coming down, you will have a gauze pad or a pack, like you will hold that bleed. Okay. So, that will help you to just hold. Okay. And you have to rule out why is this bleeding taking place, because of hypertension or any other injury you have to rule out. Okay. So, that is your first management. Sit forward, applying direct pressure. So, you make the patient, you put a gauze in that area and you have to tell the patient to hold, and what you have to do is like you have to apply direct pressure on the nose. That is like after the nasal bone is ending, you have to come down and you have to pinch the nose tightly. So, it is around 10 to 15 minutes you have to pinch the nose tightly so that the bleeding gets arrested. So, that is the first management when the patient is entering the hospital. And then like you have to avoid the backflow of the blood to the throat. So, what happens when it is like backflowing? So, either the patient will aspirate when it is getting entered into the lungs, it may get aspirated, or otherwise if it is like again if the patient is trying to swallow, what happens? This blood will go and get accumulated in the stomach. So, it will cause nausea and vomiting, and the patient will start vomiting also. So, that is also an like secondary effect what is going to happen after a nasal bleed. So, you have to be very cautious that the patient doesn't swallow or doesn't go back with the lungs. Okay. So, avoid the backflow of blood. And then we have cauterization if needed. So, in case if you suspect, maybe because of nasal pick we have discussed. So, if there is a nasal pick, when there is an injury, at that time because of that nasal pick there may be a bleed. So, in case of these condition, what you have to do? You have to go in for a cauterization. So, you can cauterize this particular minor arteries or the veins like where it is bleeding. Okay. And then we have ice packs. So, ice packs you will like you have to apply. So, either like you have to put ice cubes in a cloth and you can directly apply on the nose, like because of that it will cause vasoconstriction and this bleeding can be arrested. And then we have control of blood pressure. So, in case if it is because of the increased blood pressure level there is an bleeding, you have to control blood pressure. In case if you suspect some other blood disorders or coagulation disorders, you have to rule out that also. And then you have pressure balloons available. So, what you have, like you have catheters available, where what you will be doing is like those catheters you will insert and you will apply pressure. So, inflating these balloons will like what they will do, when you are inflating balloons they will like swollen up. So, when they swollen up they go inside and then they swollen up. So, what happens? There will be pressure applied on the all the capillaries and the blood vessels around the nose. So, what will happen? Because of that pressure bleeding will be controlled. So, that also you can do. And then we have avoid blow, rub and bending. So, all these things which are going to promote epistaxis you are going to avoid. So, you have to prevent blowing of the nose. So, when there is a bleeding, tell they are not supposed to blow their nose, and they are not supposed to rub when there is an irritation, they are not supposed to rub, and when there is a bending, when they bend, like keep on bending too much, what will happen? Because of gravity it keeps on blowing. Okay. See to that it doesn't fall back, you doesn't allow the blood to go back, but just a mild tilting can be enough, but too much of bending also like can cause increased bleeding. Okay. So, this is the management of epistaxis. So, in epistaxis we have discussed the definition, the etiological factors and the incident level, and then the management in common condition. Hope you understood epistaxis, and in case if you have any doubts, ask your doubts in the comment box. So, let us discuss another topic in the next video. Till then, bye, take care.